Good morning. I hope you're doing well today. My name is Andrew, and my colleagues Reagan, Dominique, Cody, and Ashley are all here to educate you about your prescription for metoprolol, which is a beta blocker to help with your high blood pressure. Next, I'll hand things off to Cody to begin the education.
Beta blockers work by decreasing the workload of the heart and decreasing the strength of contraction by blocking the efforts of one of our stress hormones, epinephrine. We know this hormone better as adrenaline. Adrenaline acts to make our heart beat faster. When the acts of adrenaline are blocked, the heart can pump slower and contractile efforts are decreased. This allows the heart to beat more regularly and decreases its output. Decreased cardiac output leads to decreased pressure on the body's vessels. This also decreases the oxygen demand of the heart. In addition to treating high blood pressure, beta blockers are also used to treat other conditions of the heart, such as chest pain, irregular heart rhythm, used after the instance of a heart attack to prevent further heart muscle damage and death, and they can also be used preventatively for migraines. But let's talk a little bit more about high blood pressure, as that's why you've been prescribed metoprolol today. High blood pressure or hypertension is a condition in which blood flow against the vessel walls becomes consistently too high. This is generally characterized by multiple blood pressure readings greater than 140/90. As mentioned before, beta blockers block adrenaline, allowing the heart to slow down, thus reducing its oxygen demand and output, which puts less pressure on the body's fragile vessel walls. Now, I'll let Andrew talk to you about how to take this medication.
Now, how do you take metoprolol? Metoprolol should be taken with water and at meal times and should not be chewed. Try sticking to the same medication schedule, so if you're taking the medication at 8 a.m. every day, continue to take the medication at 8 a.m. Tablets can be split in half if needed for easier consumption. Next, I'll have Reagan talk about dosaging and possible side effects for metoprolol.
Dosage for this medication is available in two different forms. There is the immediate release, which will have an effect on your body right away, and the range for that is 25 milligrams to 100 milligrams. And then there is the extended release, which will have an effect on your body for a long period of time, and that range is 25 to 200 milligrams. So your prescription should have a dosage in one of these two ranges. For possible side effects, there are a lot of common side effects that relate kind of sort of to your head, which is dizziness, headache, tiredness, anxiety, or depression. And then there's some other side effects like diarrhea, itching, your heart rate might feel a little slow, or you might have a little difficulty breathing. And there are some more serious side effects like heart failure, a lack of blood flow to your arteries, or even fluid in the lungs, which just because these are all listed does not mean you will have these side effects, but they are possible when taking the medication, even though they don't occur every single time for every person. And next we are going to talk about storage.
How to properly store. This medication should be kept out of the sight and reach of children. Do not use these tablets after the expiration date, which is stated on the carton after the letters EXP. Store this medication in a room temperature environment between 68 to 77 degrees Fahrenheit. Avoid exposure to heat. Do not freeze, and discard any product if it contains particulate matter, is cloudy, and or is discolored. Medicine should not be disposed of via wastewater or household waste. Ask your pharmacist how to dispose of medicines no longer required. These measures will help to protect the environment. Ashley will now speak with you about patient education.
Patient education for metoprolol. It should be taken with food or right after eating. This drug may cause nausea. Taking with food will help your stomach digest it better. Do not crush the extended release tablet. You can cut along the scored line. You can cut the immediate release tablet. Your blood pressure should be checked regularly to determine your response to metoprolol. Do not take metoprolol if you suffer with heart conduction or rhythm problems, have severe or uncontrolled heart failure, have a slow heart rate, have low blood pressure, have breathing difficulties or asthma, suffer with diabetes with frequent low blood sugar episodes, or have liver or kidney failure. Next, Dominique will be talking about important considerations when taking this drug.
When taking this medication, there are some things to consider. Do not give this medicine to children. If you're pregnant and/or breastfeeding and have high blood pressure, speak with your healthcare provider about your treatment options during pregnancy and/or breastfeeding. This medicine is a Category C pregnancy drug. This means two things. 1. Research in animals has shown adverse effects to the fetus when the mother takes this drug, and 2. There hasn't been enough studies done in humans. Also, for women who are breastfeeding, metoprolol enters the breast milk and could pass to the baby. If you are going to have an operation or have anesthesia, please tell your doctor or dentist that you are taking metoprolol tablets, as your heart rate might slow down too much. Next, Cody will talk to you about double dosing.
Look out for these other names for beta blockers. You'll recognize them by their endings, LOL.
If you have any questions or concerns, please contact your healthcare provider's office.